Welcome to the Haematology and Oncology Day Unit at the Royal Bournemouth Hospital. My name is Amanda Brampton and I'm one of the specialist nurses on the unit. We have created a short video to show you around parts of the hospital that you may visit whilst you're having treatment with us. We hope that this video will help you feel more at ease whilst you're planning your visit and during your time with us at the hospital. Before attending for treatment, you will be asked to have bloods taken. This will take place in the pathology department, which is on the ground floor of the west wing of the hospital. You will be given a time to attend for this. You will be required to attend for a blood test before every course of treatment. Before each course of treatment, you will need to have a COVID-19 swab. We currently have a drive-through swabbing team based in the Village Hotel car park opposite our emergency department. Wherever possible, you will be booked to attend the drive-through straight after your blood test. It is important that we have all the information we need before your medical team prescribes your treatment. We will always explain if there are any other investigations you may need, and we will need to take a record of your height and weight before you begin your treatment. Following your initial appointment to meet a doctor from your team, you will have an appointment before every course of treatment. This is an opportunity for you to discuss with a member of your medical team how you are getting on and ask any questions you have. Your outpatient appointments will either be over the telephone or face-to-face. Face-to-face outpatient appointments and treatments take place in the Haematology and Oncology Day Unit on the ground floor of the Jigsaw building. The Jigsaw building is at the back of the hospital and accessed through the west wing entrance. Available car parking is signposted. You will also be issued with an application form to apply for concessionary car parking. Local buses run to the hospital and arrive and depart from a designated area at the front of the hospital. If you wish to inquire about hospital transport, please speak with the reception staff on the unit. When you arrive on the unit, you will be greeted by our reception team, who will direct you appropriately. If you are attending for an outpatient appointment, this is the waiting room where you will wait to see a member of your medical team. There are also toilet facilities on this corridor. Your doctor will come and introduce themselves and take you with them to their consulting room. If at the end of your consultation you are asked to book in for a further appointment, make sure you speak to the reception staff before you leave the department. The reception staff will make the appointment for you. Visitors are not currently able to come with you for your treatment. This is to keep you and our staff as safe as possible. Please let a member of your medical team know if there is any reason you may need a carer, friend or relative to support you whilst you're attending for treatment, so they can talk with the sister on the unit. When you arrive for your treatment, you will be greeted by the reception staff, and on the day of treatment you will be asked to sit in the reception area at the front of the unit. A member of staff will take your observations whilst you are waiting for your chemotherapy nurse, who will introduce themselves and welcome you to the treatment room. The treatment room is a large, airy 10-bay area. You will have a reclining armchair to sit in, and whilst you are fully visible to all the staff on the unit, you have privacy due to the sloping partitions between each bay. The nursing station is in the centre of the room, so it is easy to attract attention if you need to speak to a member of staff. We suggest you dress for comfort on the day of treatment, and if you have long sleeves, you'll need to be able to roll them up so that your infusion can be observed by the staff at all times. Your infusion will hang from a wheeled drip stand so that you can get up if you need to access the toilet facilities in the treatment area. If you need any help, please don't hesitate to ask a member of staff. Tea Coffee, fruit juices and a selection of individually packaged biscuits and cake are provided mid-morning and mid-afternoon. At lunchtime, we are able to offer you a sandwich lunch, fresh fruit and yoghurt. If you wish to bring your own snacks and refreshments, you are welcome to do so, but the unit does not have any fridge space to store this for you. We have Wi-Fi available on the unit, so you may bring tablets and headphones with you. Many patients bring magazines or a book to entertain themselves with whilst on the unit. During your treatment, your chemotherapy nurse will arrange with you your follow-up appointments for your next blood test, COVID-19 swab, and your outpatient appointment with a member of your medical team. If you have any concerns or particular needs we need to be aware of, please mention this to your medical team at your outpatient appointment. Your doctor can then let the nursing staff on the unit know. If you need to rest on a bed for your treatment or are attending for a procedure, investigation or for a doctor's review, you may be seen in either the review bay or one of the single rooms on the unit. We run a 24-hour hotline for you to access immediate advice and help whilst on treatment. You will be given this telephone number. Please always telephone the 24-hour hotline if you're experiencing side effects, physical symptoms, feel unwell or have concerns. Please do not come to the unit if you are feeling unwell without first having called the 24-hour hotline for help and advice. Coming to the unit feeling unwell without first having called the 24-hour hotline may cause delays to your being seen and receiving the appropriate help and treatment you may need. Ward 11 is our inpatient haematology ward. It is here that haematology patients may be admitted for investigations, procedures and receive treatment. This is also where we carry out autologous stem cell. Thank you for watching. We hope this has been useful. If you have any questions that we have not answered, please do not hesitate to speak with your specialist nurse or a member of your medical team, who will be happy to help.